So with the 11-12 Gracey, again, now we're back to a Gracey, so we have a lower and an upper cutting edge. So therefore, when we insert, we want to cup that instrument as close to the tooth as possible. We don't want to insert so that the back of the instrument cuts into the tissue. So get this out of the way. I'm going to pull the patient's cheek back. We're going to work on our distal line angle again. So our insertions are on the distal line angle. So again, your insertion slides down that distal line angle. The insert slides right underneath the tissue. There should be no pressure whatsoever. And as you make your stroke and come around, stand up. Everything is on your fulcrum. Rotate the instrument and finish interproximally. Again, stand up. We're directed toward the tissue. We're flat against the tooth or cupping the tooth with both blades. Slide in, stand up, activate your instrument. You'll hear that scratching sound. Come around, parallel. There we go. Slide down the distal line angle, stand up, come around, finish your stroke. Again, lower cutting edge, directed to the gum line, slide down under the tissue, do your stroke as you come around, standing up with the tooth surface. Slide down, stand up. Buccally, same thing. So you may have to adjust your positioning. Slide down the distal line angle. Do your stroke again. Rotating the instrument around the line angle and coming up the side of the tooth. Or cup the tooth as best we can. Slide down the gum line and we're already inserted. Take your strokes. Stand up as you come around and finish interproximally. Terminal shank is parallel to the long axis of the tooth. On the buccals of the maxillary right side, we're going to insert on that distal line angle, stand up, and come around the tooth. Rolling the instrument in your fingers. Only thing moving is the fulcrum. Again, finding the lower cutting edge on the 13-14 is very important, and this is usually the instrument that throws the student just a little bit on how it should be placed. You can see that the instrument is very bendy, therefore it allows us to reach farther back in the mouth. So our lower cutting edge is here. Again, we hold the instrument up in front of us. You can see the lower cutting edge is here. That lower cutting edge has to go on the tooth surface, and we want to make sure that we can keep our instrument parallel. So the second bend of your terminal shank will come back up and over toward the front of the face or toward the chin. So again, it's insert, stand up, and the strokes are small, and that's the only surface that we use this instrument on. Again, slide down the midline, cupped, stand up, come up the tooth, holding again back the tongue, keeping things parallel, insert, stand up, come up the side of the tooth, cupping the tooth, again, lower cutting edge toward the tooth, cupping the tooth, stand up so that the second shank is coming out the mouth. So we insert, closed, stand up, come down the side of the tooth. Insert, closed, stand up, come to the side of the tooth. Now, what would it look like? Okay. So we'll slide down the side of the tooth, stand up, rock the instrument down on the tooth. My hand's going to be down here around their chin so I can keep the instrument nice and parallel. As you move up, try to stay a tooth away from where you're inserting the instrument so that you don't slide it or slip and come up into your pad of your finger. Again, ending with the terminal shank being parallel to the long axis of the tooth. Surfaces towards you on the maxillary. Again, insert on the distal line angle, stand up, come down the side of the tooth. I'm fulcruming on the lingual surface to give myself more room here. Insert, stand up, come down the side of the tooth. To redo this anyway. Okay, so for maxillary surfaces, again using the 1314, which is only used on distal surfaces, get your fulcrum, slide down the tooth surface on that distal line angle, stand up, and work yourself around the surface. Again, remember, there's not very many strokes and there's not a lot of space back there. Again, make sure to finish with your terminal shank straight up, parallel to the long axis of the tooth. We're going to scoot back just a little farther. You may have to extend the instrument in your hand. Again, toe pointed toward the gum line, slide down, stand up, rock. Toe pointed to the gum line, slide down the line angle, stand up, rock into the interproximal space.